Started. We're going to do things a little bit differently today, kind of towards the middle to the end. We're going to sort of split up into some breakout rooms to have some discussion and then meet back up. So just a heads up. But otherwise, we can go ahead and get started kind of on our usual way. So I'll share my screen. All right, so session number 4. Sorry we had to miss last time, but I'm glad that we get to get back to it today. Hopefully you guys all had time to watch both of the episodes for this one, since we had a little bit of extra time to view. So I think that one of the biggest things, and I'd love to hear some of your general thoughts, but I think one of the biggest things that stood out to me from these episodes was Toru and her dealing with her mother's death. I was wondering if any of you had any thoughts about the 2 episodes, if you noticed that as well, if that was one of your big takeaways, or if you had any other things that you also noticed that you thought was worth discussing. So raise of hands if anybody noticed Toru dealing with the death of her mom. Yeah, certainly. So, it's definitely something that we'll be thinking about really throughout the series, and something that affects her kind of long term and going forward. And obviously, they mentioned that it's been the first year anniversary of her mother dying. So that first year is certainly a very pivotal time for people experiencing a loss. So, I wanted to kind of focus today on discussing that differential and kind of what loss of a loved one and what grief can end up looking like. So, first, I think is always good to start with like normal behavior. So uncomplicated bereavement, which is sort of what we think of as the usual response to somebody losing somebody that they're close with, somebody they had a strong relationship with, somebody that they loved. And so this is something that we would generally see as the normal reaction. And that normal reaction for grief can oftentimes present with some of the symptoms that we usually think of with, say, a major depressive disorder. That can be very feelings of sadness. Usually when they're feeling sad, they consider that to be quite normal based on what they just went through. They might also experience like insomnia, a poor appetite, weight loss. I don't know, depending on your culture, a lot of cultures will have sort of the norm be to say bring food to the family members when somebody dies. And that might be because of this general sort of trend that they might not have the same amount of appetite, or they might not be trying to take care of themselves in the same way because they're focused on those feelings of sadness. And we always have to keep in mind that cultural context and consider that duration and expression of what is normal can really depend on the culture. And this is one categorization in the DSM that's considered other conditions that may be a focus of clinical attention in the future, but isn't considered a diagnosis in the DSM at this point. And, it's something that many people experience based on the loss. And we have to consider this like versus a major depressive episode. So is this a normal grief response? Or is this an episode of major depression that is sort of triggered by this suffering? And so while it's very normal for the death of a loved one to lead to a lot of suffering, we don't usually think of it as leading to an episode of major depressive disorder. And usually if that does occur together, those symptoms are generally more severe. And we worry a bit more about patients in which this bereavement can lead to a major depressive episode. And it usually happens to occur in patients with like other vulnerabilities to depressive disorders. So, that's like strong family history or, other biopsychosocial factors that could put them at risk for that. And in this context, antidepressants might facilitate that recovery. We might also, be considering this if that like significant loss, and we have to keep in mind that significant loss, when we're thinking like major depressive episode, like it might be bereavement, but it could also be significant loss of other types, like a financial ruin or losses from a natural disaster. And, we see that in the world today when, we have these big natural disasters, like a huge hurricane that can, take everything away from a person. We also have to consider like a medical illness or a disability, anything that is adding to a real loss of something that they held dear to them and something that was a part of kind of their everyday life. Those can induce that feelings that maybe resemble a depressive episode. So some of those Siggy Cap's classic symptoms. And, even you as their treatment provider or somebody, who knows them might think those symptoms are very understandable and even, appropriate, given the context and given what they're going through. So it's important to be very careful in the consideration of whether we think that this episode of grief versus an episode of a major depressive disorder. And so, we have to use clinical judgment and consider each individual patient's history and their cultural norms. And so here's just kind of an easy breakdown where we think of grief. The feelings are focused on emptiness and loss. Rather than in a major depressive episode, they have a very persistent depressed mood and they can't anticipate happiness or pleasure. In grief, you might have like dysphoria, and there's kind of a timeline for that. They'll like experience what we classically think of these pangs of grief. And that's usually associated with a prompting, like thoughts or reminders of the person that they loved who died. When they think of that person, they might experience, a very intense but short-lived experience of grief and sadness. Whereas in a major depressive episode, that depressed mood is going to be more persistent and unprovoked. It's not necessarily tied to those thoughts or preoccupations. And given that the major depressive episode is persistent, we think of with grief that they might have associated positive emotions and even humor associated with those pains. So, they might think of a story that reminds them of that deceased loved one, and it might make them feel grief, but it also can make them feel a mixed emotion of, a humor about something that was funny in the story, but it also makes them sad about missing the person. So it's a little bit more of a nuanced and complex feeling rather than a more persistent feeling with a major depressive episode. And then we have to think about the thought content as well. In grief, you're going to be having that preoccupation with thoughts and memories of the deceased. Rather than in major depressive episode, you're going to just see that pervasive unhappiness. So it's not necessarily tied to the specific thoughts and memories. Also in grief, the self-esteem is generally preserved. Whereas in a major depressive episode, they're going to be self-critical, they're going to feel very pessimistic, they're going to feel possibly worthless or even self-loathing. And grief, if they do have that self-derogatory thought process, it's going to focus on their perceived failings. And, you might have experienced this with people that you've known where after a death, they might feel guilty that they didn't visit frequently enough. Like say if, an older parent passed away, they'll say, oh, I should have visited them more. I got too busy with my own life. Or they might feel like they didn't tell them how much they were loved and, sort of wish that they could go back and change some of those things. But it's not necessarily about anything else in their life that they would feel like worthless about. Just a few focused things on involving the deceased. And if they do have thoughts about death and dying, that's also generally focused on the deceased. So thoughts about death and dying relating to the deceased, or thoughts about their own death and dying with this possibility of maybe joining the deceased. Oh, when I die, I'll be able to at least join my mother who's, um, passed away at this point, that type of thought process. Whereas in a major depressive disorder, when they think about that death and dying, it's going to be focused on themselves and on ending their own life. And it's going to be relating to those feelings of worthlessness, feeling like they don't deserve life, or feeling like they can't handle the pain of their day-to-day depression. So that's kind of a good way to sort of think about the differences between the two. If you're seeing this sadness in somebody who might have experienced grief, but wondering which it might be more a symptom of. And then we get toward a persistent complex bereavement disorder. And this is actually categorized in the DSM-5 currently under conditions for further study. So it's not under, the classic dynamics as like a major depressive disorder would be. So definitely something that we will still be exploring in psychiatry and psychology. And we have to keep in mind that there is one subset of this as well that's with traumatic bereavement. So that's in the case where the death of a loved one was due to a homicide or a suicide. So, there's certainly a trauma component when something like that happens. And when we see this, we might see a bit more of like persistent distress or preoccupation about the traumatic nature of the death. So not just the death or missing the loved one, but specifically the occurrence of the death and, those last moments, or, if it was a homicide, maybe the malicious nature of the death. So they're really focusing on the death itself and not necessarily just missing the loved one. So in general, diagnostic criteria for this, we're going to be thinking about how we're going to be seeing this in somebody where the patient has experienced the death of someone that they had a close relationship with. So, a loved one, like a close friend, something like that. And a timeline is certainly important for this one. So we wouldn't diagnose this unless these symptoms have been present for at least 12 months, so at least a year in adults. And keep in mind, for children who have kind of a different concept of time, it'd be 6 months for children. But generally think of 12 months for adult after the death. And those symptoms happen more often than they don't. So, at least half the time, these symptoms are occurring. They're experiencing these symptoms on a very regular basis. And as with most other disorders, it causes a clinically significant impairment. So that might be in social situations or in their occupation, not being able to show up for work or school, or be present when they're there, or other areas of functioning. This can even lead to some harmful health behaviors like increased tobacco or alcohol use. And as with most things as well, it's going to be out of proportion or inconsistent with cultural, religious, or age-appropriate norms. So, we always have to remember that cultural context or religious context. And this is certainly very important for a persistent complex bereavement, because each society has, different cultural norms for expressing loss and expressing grief, and, all of the things that go along with how a society handles the death of somebody in that society. So very important to consider. But now I kind of want to focus on the main thing that we're going to be doing today, which is our breakout rooms. So what we're going to do is I'm going to send in the chat a list of different symptoms of persistent complex bereavement. And I'm going to specify for each of the rooms which ones that I would love for you to discuss. And so I'd really love it if you could discuss your room set of symptoms and how you think that those might be related to the episodes that we watched for this session. And if you can find any good examples or, specific moments that really stuck out to you that might be relating to those symptoms. And, if you want to be able to kind of also think about sort of that differential that we were just talking about. Is it a more persistent complex, or is it more aligned with that uncomplicated that we just talked about, with that normal grief? Or is it something that you would be worried about a major depressive episode rather than, focusing on that specific loss of a loved one? So we're gonna split you guys up into rooms, and we'll send out the list of symptoms for each. And we'll probably give you like 10 to 15 minutes to discuss. And we'd love it if each room could pick one person when we come meet back up together to go through. I'll pull up a slide for each set of symptoms. And if one person could go through discussing those symptoms and, what you guys talked about and what you really related with for the episode. Does that sound good for everybody?
Upbeat, he still has a playful behavior. And we think he exhibited that just because, since he was never able to do that with his mother, he now wants to do that with somebody who can fulfill that caretaking role. And we were discussing that maybe that's why he's so close to Toru, because she has those characteristics that make him feel at home, make him feel as though she loves him and that he's nurturing. So he may have an attachment to her. As far as whether it's normal grief or a major depressive episode, we think he could have an inclination towards major depressive episode, just because of the fact that it is kind of like a wound that doesn't close, because he has to go through that every day. He has to live with the fact that his mom doesn't remember him. But we don't think it's that. We think it's just regular grief, because he doesn't show any symptoms of low self-esteem or being depressed. He still seems like he's happy, unless he's really good at hiding it. But those are our thoughts.
Yeah, I think that that's a great insight. I think you're right that is a wound that doesn't close, but at the same time, he's able to kind of get by in the day to day and isn't focused on that sadness at all times. And he doesn't have, that focus on the intense sorrow every day. He's able to have fun and be playful, even though he does have that kind of wound that will always be there to some degree. And so I think that's really good that you noticed that kind of important distinction there. And I agree. I think Momiji is a great representation of this. We have two people in this who have suffered, the loss of a mother, this very important and close caretaking role. And so having to deal not just with the loss of a loved one, but specifically the loss of a caretaker on a child. And so certainly presents itself a little bit differently than just, say, an adult might as well. So great insights. Does anybody else have any thoughts on how Toru might be representative of this as well?
She kind of has that yearning, longing for her mom, because she's like always thinking about her, and like persistently, and like she doesn't really kind of accept what's happened, and it's sort of like unhealthy for her.
Yeah, she really seems to have a hard time accepting this, and she really does have a lot of that yearning and longing as well. Like we see it when she is at the spa, and she's even bringing her mother with her to the water in this with the picture that's inside of a Ziploc, because she wants her to be a part of it. She yearns for her to be there, and has a hard time really like letting go with that. Yeah, certainly. All right, well, thank you so much, Christy. Room 1 did a great job. All right, room 2.
Yeah, so we were talking about like specifically with marked difficulty accepting death, like Sage was just saying, like Toru still acts like she is still alive, kind of like she still talks to her. And in the hot when they went to the inn, like she brought her mom's picture into the hot spring, so she's clearly like still attached and like thinking that she's like alive, basically. And then maladaptive self-appraisal, I wouldn't necessarily say it's self-blame, but I remember seeing where she didn't get to say like a proper goodbye like the last time she saw her. So it's I don't know if that would be exactly maladaptive self-appraisal, but it's definitely a regret she has. And then relating to Kyo, I would say difficulty with positive reminiscing about the deceased, because when they were kind of like celebrating like at her mom's grave and like having a picnic, he was like having difficulty understanding that and like why they were like very positive about it and just having like kind of a good time. But yeah.
Yeah, definitely. I think it's interesting that you bring up Kyo's reaction. I'll not try to give spoilers, but it's something that's going to come up later. And his reaction was very odd, right? It seemed a little bit unusual for somebody who's, just experiencing being with a friend and trying to help a friend through their own loss. So it sounds like there's definitely more to unpack with Kyo there. Definitely not what we would have expected, and not quite everybody else's reaction, like Yuki, who did not know her mom. We see a different reaction with him as well. Yeah. And yeah, I think it's really great that you pointed out that disbelief. We've seen that, and people have pointed it out even from the beginning, where people, where Toru was having that hard time believing, where people noticed that she, when the landslide happened and it covered her tent, when she was so upset that her mother's picture would have been buried, and she was trying to get to it and saying, my mom's in there, my mom is in there, not my mom's picture is in there, but specifically my mom is in there. So we've been seeing this really throughout multiple episodes, where she's having a hard time really accepting that death, and still kind of referring to her mother as if her mother's picture was her mother. How about the sort of like the negative reminiscing and the difficulty with the positive reminiscing? Do we see that with Toru at all? Yeah, I agree. We don't see that with her. She really actually focuses almost exclusively on kind of the positives. My mother is so wonderful. My mother was this. My mother is so great. So although she has an easy time with the positive reminiscing, she does it quite a lot. We see her doing it regularly. And we'll see even later on that this has become something that people start to notice quite a bit. Now, I was curious if anybody else, I think Room 2 did a wonderful job, and thank you, James, so much. I was wondering if anybody noticed any of these things in some of, the other characters, like Momiji. Did we see any of these things kind of happening with him? Though he didn't have a death, he did have a very serious loss of his caretaker and mother.
I would say that maybe he has like some difficulty with like positive reminiscing, but also he doesn't really have like that many positive, because the one scene that we did see in the episode, his mom is like talking about how she didn't want him. So I think that like maybe something is that he focuses, it's kind of like the opposite of Toru, like he focuses a lot on the negative and like not wanting, like that feeling of like not being wanted or not like belonging, and focuses along a lot like when he was like, oh, like a mom would never want like a child who like you can't hug, so
Yeah.
that may be one thing.
Yeah, that negative reminiscing, and maybe even the bitterness or the anger. He really kind of talks a lot about that, of like, is he upset with his mother? That idea of kind of like repression or suppression. And does he kind of resent her for making that choice? And, he says very clearly that he, in that circumstance, would not want to make the same choice that she did. So he definitely does seem to hold a bit of anger and resentment towards her. Well, thank you so much, James. Room 2 did a wonderful job. All right, room 3.
So that was my group. So we we more focused on like why we've more focused on like Toru and like kind of like some of the symptoms associated, but what's kind of interesting and what James group was talking a little about before is like how she more focuses on like the positive aspects. So instead it's like excessive avoidance of loss reminders. Like I feel like she kind of like talks a lot about her mom, like she visits her grave and like brings the picture like even to the spot in the water and is like, look mom. So I feel like more instead of like it's kind of like an overabundance of like her mom and like memories associated with her. And then we talked a little bit about like the social identity and disruption. I feel like maybe she definitely displays like some symptoms of this in the sense that like a lot of her identity is like aligned with like her mom's values and like when she was talking about like her mom and how like they can't pay for school, like she was like getting very upset mostly because her mom was like very much about like education, and when she like couldn't pay that or like wasn't focusing on it as much, like she gets very like disruptive and like with herself and gets very like anxious. And then we didn't say like I feel like Toru doesn't really have like the desire to die to be with the deceased, but like also that may like intertwine with some of the feelings of like her mom still being there. So instead she's kind of like recreating like her mom in like a interesting way to kind of like be with like still be with her. And then I personally said that maybe Toru trusts too easily, so like kind of the exact opposite of that, but instead because I feel like she just kind of like is very like willing to trust people, and then feeling alone or detached. We said that maybe in the tent like she would feel that way. Now that she's living with like Sugure and like with Yuki and Kyo, like she may not, but like living in the tent probably definitely spark some of those feelings of like isolation, and also the fact that like her grandpa like abandoned, I don't want to say abandoned, but I kind of feel like he like abandoned her because he like let her live in a tent, which I still find really interesting. But yeah, so that's why I was just like that's kind of like where our group was in terms of that. But some of them we definitely saw, but a lot of them are also kind of like opposite, which is kind of interesting because that still kind of begins
Yeah,
to.
and we have to kind of think about that like phase.
Did you say something? Because it like
Oh
cut out.
yeah, I think it cut out for a minute for me. Sorry, guys. But yeah, no, I think that you really noticed something that's very interesting, and kind of thinking about like that timeline as well. Like she's so caught up with that, one of those first things of that disbelief and like not willing to accept it, that it's almost like she wouldn't even be at this stage where she would be able
Yeah.
to experience some of these symptoms.
Yeah.
It's hard to desire to die to be with the disease if you still aren't accepting that the deceased is deceased.
Yeah.
Right.
Yeah. I feel like I could definitely see though, like if she were to like accept her mom's death, like I could definitely feel like maybe she would have some of these just because of like the way she interacts now with her mom and like how close they were. Yeah,
Yeah.
that's
I think those are fantastic insights. And yeah, I thought you guys did a good job with like that social identity disruption of identifying that Toru does identify herself so much as in the role of daughter. Daughter is almost a defining part of who she is as a person. So that disruption of that defining role has been really difficult for her. So I think that's fantastic. You guys did a great job. Thank you so much, Liz. Okay. And my screen is slowly changing. All right, so we have the next room.
So for ours, we did Toru, but we didn't feel that she fit a lot of these. The first one, we did feel that in a certain sense because she does have trouble functioning without her mom. You know, she brought her picture to the hot springs and everything. And when the tent got overtaken by the storm, the first thing she did was freak out about her mom's picture. So it just seems like she kind of has an attachment and she does have trouble functioning without the memory of her mom with her, at least with that picture. That's the symbol of it. And then confusion about one's role in life. We don't really feel that that fits Toru. If anything, we feel that that fits Kyo. He just seems like he has kind of trouble connecting with people and seeming like he knows where he fits in and everything. And then, well, he doesn't have a disease, but we just felt that that character trait fit Kyo. And same thing for the third one, we felt that it fit Kyo. He's having trouble with friendships and planning because even getting him to go to the grave site or go to the hot springs with his own family, it took a lot of begging, and Toru was really the only reason that anybody could get him to go and do anything.
Yeah, and I think again, your group did something wonderful, which is seeing a lot of this in Kyo. And we haven't seen him have a deceased at this point. That doesn't mean that he hasn't had one. We just haven't been shown that in the season so far. So I think you guys did a really good job of seeing symptoms in him that are concerning and might even be especially concerning if we knew that he had experienced the death of a loved one. So I think that it's really great that you guys are noticing that. I won't give too much spoilers, but it's entirely possible that somebody in Kyo's life has passed away and he's having a hard time accepting that as well. And he's really struggling in his interactions with Toru in relation to processing grief and how he's able to cope with it and do that as well. So I think you guys saw more than the show even meant for you to see. So good job there. And yeah, I do agree with you, like not being able to function without the deceased. For a lot of adults that we would think about that, we would see it as, oh, I can't go to work. I can't go to my social engagements. I don't want to go see friends because how could I go without, my so-and-so who has left me. But with her, we do see it's more of she's adopted this picture of her mother as representative of her mother, really being there with her. And whenever she is faced with a circumstance in which she doesn't have that picture, she has a very strong reaction to that and really feels like she can't function if she doesn't have that picture there with her. So we're kind of seeing it represented in a very interesting way. So I think that that's fantastic as well. And thank you, Samantha, so much for presenting that for your group. Okay, and finally, the last group.
So we said that for hallucinations, she doesn't really, or we're really talking about Toru, but how she doesn't have any like, I guess concerning hallucinations, but she does like visually see her mom or like hear her voice when like she thinks about her a lot. I don't know if you'd call it concerning, but she does talk a lot about like present tense with her mom, like as if she were still existing. And then she doesn't really show any I guess health issues in general, but she does like overwork herself a lot and like try to preoccupy herself, and so I guess so she doesn't think about the negative parts of her mom's death, because she talks a lot about like the positive memories she has, but she hasn't really talked about like how her death like has like actually affected her, and like I guess the worst parts, like how she was living in a tent and like she doesn't live with like her actual family, she lives with like friends and like their family. And then she does get like sick kind of often, because even in the first episode she like gets sick after the landslide, and she her anxiety increases and her stress, and it like affects her health. Rather like than most people, if they're like stressed and stuff, they don't, I guess them getting sick or fainting isn't the first thing that happens to them. But yeah.
Yeah, I think that those are really good observations. We do see her getting sick more than anybody else in the show. And so, that is something to note where sometimes when the mind can't process a feeling, the body kind of does it for them. And so, she's really kind of putting herself at risk for some of that by the overworking. She's constantly at her job, or she's trying to do so much around the Soma house to make it run smoother. So she's really exhausting herself, which is making her more at risk for getting sick. And then also, maybe that sickness, that feeling of like the fatigue and being tired and not feeling well could also be a somatic complaint as well. And you're right, we don't necessarily see any hallucinations with her. It's more of just kind of that believing the representation is almost there. She really does talk about her mom in present tense, like you said. It's very noticeable. And so I think that was a good thing to point out. So thank you so much. So yeah, I think you guys have all done such a fantastic job. I love that we got to hear a bit more of your thoughts and have you work together today. So just kind of wrap up a few things to keep in mind would be like prevalence. So 2.4 to 4.8% of the population, you might see this in, which isn't a small amount compared to some of the other things that we look at. And also females more than males. So, thinking of Tober there. And then like development and course, it's interesting. The DSM says that this can occur at any age above 1 year old. So you might even see this in very young children, that difficulty with handling and coping with a loss. Symptoms usually begin in those first few months after the death, but interestingly, it can be delayed. It can be months to years before a full syndrome appears. And then as we've kind of noted in several of the different symptoms, sort of that difference with young children and how losing that caregiver, not only is it traumatic for the loss of a loved one, but for the role of caregiver. And if you have a disturbance in that support afterwards, it can really increase this risk for a child. And, a child might see more of the separation distress, like how somebody pointed out with Momiji being, becoming very attached to Toru very quickly. And then in older children or adolescents, it might look more of that social identity distress. So like in Toru, we see more of that identity distress. So I think that you guys have all done some fantastic jobs today, and I look forward to next week. Again, of course, we focused on DSM for this discussion, so references there if you want to go and check anything out. And I'm going to send this slide set to Amaya to send out to you guys. All right, thanks so much.
Thank you.
Have a good day.
Thank you.